For many years, Canada used to have a reputation of having a great healthcare system, but for decades now, that reputation has faded with long wait times, shortage of medical professionals, right? Other nations outperforming Canada. Is there something we can learn from these other countries? Well, joining us from Montreal today to chat about this is Yanick Labrie. He's a health economist, a public policy consultant, and a senior fellow of the Fraser Institute, where he authored a new study entitled Building Responsive and Adaptive Healthcare Systems in Canada, Lessons from Switzerland. Good to have you with us, Yanick.
Thanks for having me.
You bet. This sounds like a really interesting study. I went through it to as much of a degree as I can understand as a layperson. But tell me overall, I guess, how does Canada measure up when compared to other OECD countries that also have universal health care? Did we, crack the top 10?
Well, not at all. Very bad. And this is precisely why I've looked at other countries and this particular case in Switzerland. No, Canada is not doing well. And it's been a case for several decades, as you are well aware. There are structural problems with wait times, especially in Canada, in every province. And it's time to act, and it's time to draw lessons from other countries. Switzerland is a model to follow.
Okay. Well, again, you're specifically looking at the Swiss healthcare system. Well, one stat that I saw that I think speaks quite loudly is the fact that patient satisfaction in Switzerland, I think it was around 94% versus Canada coming in at 56%. Ouch.
Yes, yeah. Well, there's a growing dissatisfaction with healthcare and the way it's delivered in Canada. And most Canadian, a high proportion, I'd say most of Canadians want to have more options coming from the private sector, among other care providers. And well, it's Switzerland, it's probably the case for decades. They've been doing a great job at offering care in a timely fashion, a lot of choice for patients when it comes to receiving care, but also a lot of options when it comes to obtaining insurance coverage, because the way it is organized and the way it is funded in Switzerland totally different from the way it is funded in Canada. So instead of having so-called a single payer system like in Canada, they get their insurance coverage from private insurance funds. There are, as we speak, about 44 private insurance funds. They compete to attract enrollees. They offer tailored benefits. They also respond to different preferences and needs. And this is probably the most important lesson to draw from the experience of Switzerland, because in Canada, basically, we have no choice, and we're, as patients, as taxpayers, well, forced to pay a large amount of money, and we put a lot of money in our healthcare systems, and we wait in lines, actually. So. Yeah.
Yeah, well, again, we do spend a lot on healthcare, but I think probably one of the main differences that we don't see it coming directly out of our bank account or out of our wallet, and so we think it's free, but it's not. I mean, if I read the study correctly, we're roughly the same amount as Switzerland as when it comes to total spending of our, percentage of our GDP, whatever.
Yep.
So, we both spend a lot on healthcare, but then why? I ask questions like, well, why then, if we're spending the same amount of money, does Switzerland have almost twice as many hospital beds? That there's something wrong with that, right? I mean, they're getting a lot better bang for their buck, aren't they?
Absolutely, absolutely. And you're talking about hospital beds, but we could look at other aspects of their healthcare system and the way they use the resources available. In terms of nurses and doctors, they have about 75% more doctors and nurses as a proportion of their population, which is a
Wow,
lot.
that's
And it
huge.
says a lot. It is huge.
Okay.
And, it does have an effect on the availability, not only of the availability of options but they can get access to care in a more timely fashion because of that. The way they use their available resources.
Yeah, yeah. Is there anything specific that Switzerland is doing that produces more or attracts and retains more doctors, nurses, as you were just mentioning there? Is there, I mean, are there better working conditions? Are they getting paid more? Like, why are there more, medical professionals there?
Well, they do have good conditions for sure. They attract doctors from everywhere in Europe, mostly. But also, there are less barriers to entry into the profession. And in Canada, and it's it's basically the same in every province. There are quotas when to get access to enter the faculty of medicine. It's quite complicated. If you're trained in another country, it's another obstacle you have to overcome. And it's good perhaps for doctors because they're paying more because of that, but for patients, it's another ball game because they have to wait in line. Like I mentioned, they quite often have to suffer on a waiting list, and we just don't want that.
Absolutely. So, as you're describing the system that Switzerland uses, it sounds like it's basically a private healthcare system, but that private healthcare system delivers universal healthcare. And I think for us, that's a little bit hard to wrap our minds around, or we're going, that can't be, right? But you're describing something that sounds like they actually have a bigger, broader insurance coverage than Canada does. So you're talking prescription meds, things like home care, long-term care, outpatient care, mental health care, these kinds of things, right? So things that we would want here in Canada, and yet it's delivered through, I think you mentioned 44 different private insurance carriers, right? So how does that work? I think I read in the study here that it's actually mandated for citizens that they have to find a private insurance company to cover their health care.
Yeah, it is. And it's been the case since the middle of 1990s. So everyone's covered. Everyone has some options between those insurers, and even if for instance, they choose one insurance company, they have options of models of care. So if they want to have, let's say, lower premiums, they can have a model of insurance model in which they have to consult a physician, a general physician first before having a referral to a specialist. It could be also a telemedicine first consultation prior to get access to a general practitioner. So in exchange of those managed care models, they get lower premiums and stuff like that. So it's tailored based on preferences of patients. But if you want the standard model, you can. And the standard model, there is no gatekeeping, which means that they don't have to go to a family doctor first. They want to see, a specialist for different reasons. They can go and see him in
they can go directly then?
Directly.
So that would mean a much shorter wait time then, wouldn't it?
Of course.
Okay.
Of course. And if you compare to the situation in Canada, you have first to consult your general practitioner, and it takes weeks before having an appointment with him. And then you have to get evaluated, and if it's needed, you need a referral to see a specialist afterwards. So it's a lot of obstacles, I would say. And for people who don't have a family doctor, and there are 6 million Canadians in that situation, it's a dead hand, right? Because you
have zero choice other than going to the emergency room if your emergency room is open that weekend. So don't get me started, right? Okay. Now this is again private. So you're having to pay for this out of your own bank account. So, and I also understand that there's some cost sharing, some co-pay, that sort of thing, right? Although I understand there is a cap on that, right? And there are exemptions for vulnerable groups, children, low-income individuals, somebody who's maybe chronically ill, that sort of thing, right? So how does that work? Because if I understand correctly, again, there is some government subsidy involved in this that comes from tax dollars, but the majority of it, I think about 2/3, is actually coming from directly out of your bank account. So, and this doesn't seem to be an irritation for most of the Swiss.
Well, it comes from you mentioned it from your bank account, but you don't necessarily have to pay directly to obtain care. Well, you have to pay some costs, a part of the cost of
Well, you're
the
paying
care you
the insurance
receive.
company, right?
You're paying through premiums, your
Right.
insurance company,
Exactly.
instead of like in Canada paying. You pay for the care you receive through general taxation.
So it could be like if you have
So
car insurance, okay, you're not paying for the accident specifically because maybe it's a big bill on this particular accident, but you're paying a
mhm,
premium, and some people have smaller bills, other people have bigger bills, but it's all covered through your premium,
exactly.
right? Okay.
Exactly. And there are, like you mentioned, exemptions because people basically they do have to pay deductibles as well when
Okay.
they seek care, they obtain an appointment, they see a doctor. There's a deductible, and the standard model of insurance, it's a little less than 500 Canadian dollars for the deductible.
Okay, is that
Uh,
deductible for every visit, or you mean
no,
over the year?
it's not. So the first $500 you have to pay out of pocket.
Gotcha.
So if you need more care and it's more expensive, you don't have to pay above that threshold.
Yeah.
You do have a co-insurance as well of 10%, and it's capped. Okay, there's a maximum.
Okay.
There's a limit each
And
year
what's
that
the
you.
typical maximum? What's a typical maximum on that? 10%, per
It's
visit. Hmm.
Yeah, it's 10% per visit, but annually the maximum is around, I'd say, $1,500 in Canadian dollars per year. And like you mentioned, many groups are exempted from paying anything. Those that you mentioned, chronically ill patients, uh, well, poorest households are exempted as well. About 28% of the population receive subsidies to pay their premiums. So there is there is a financial equity for sure. It's just a different setting than in Canada.
Okay. So you're again looking at the stats saying the Swiss are getting far more bang for their buck with shorter wait times, much more choice for, again, timely care with physicians and nurses and so forth. So I'm running out of time here, but I want to ask you briefly, if we want that in Canada, so why are we afraid of private health care? Yeah, and do you see that changing at all in Canada over the next number of years?
Yeah, I'm somehow optimistic because of the way our healthcare systems have evolved in the recent past. And when I say I'm optimistic, is that people are more and more aware of the fact that it's unacceptable waiting that long to get access to care. Because of the demographic changes, technical changes as well. People do want to exert their preferences in every aspects of their life, especially in healthcare, because they value healthcare a lot. And by being aware that other countries are doing better than us, and they do offer a universal system where everyone is covered, but in a more efficient and a more timely manner. Well, it's very important for them.
Well, we're all, whenever things begin to change, we get maybe a bit fearful. But at some point, I think we've got to, take a jump at least off the low diving board, to see if we can get some improvements here. And of course, they're trying that in Alberta. So we'll see what happens, and we'll be watching closely. But can we learn from Switzerland? Apparently, we can. Hey, appreciate your time today, Yanick.
Thank you, Paul.
You bet. Yanick Labrie, a health economist with the Fraser Institute and the author of the Lessons from Switzerland study, which you can read online for yourself. And I encourage you to do that at fraserinstitute.org.